Question: what are mass injuries? Answer: mass injuries refer to multiple injuries sustained by a significant number of individuals during a single event, such as natural disasters, terrorist attacks, or accidents. Question: what is the role of triage in mass injury incidents? Answer: triage involves prioritizing patients based on the severity of their injuries to allocate resources effectively and save the most lives. Question: how are medical resources allocated during mass injury incidents? Answer: medical resources are allocated based on triage categories, ensuring that patients with life-threatening injuries receive immediate care. Question: what is the significance of disaster plans in managing mass injuries? Answer: disaster plans provide guidelines for coordinated responses during mass injury incidents, ensuring a systematic approach to patient care. Question: how are communication systems established during mass injury incidents? Answer: communication systems are established to facilitate effective information exchange among healthcare providers, responders, and authorities during mass injury incidents. Question: what is the role of disaster medical teams in mass injury incidents? Answer: disaster medical teams provide specialized medical care in disaster-stricken areas, supporting local healthcare systems during mass injury incidents. Question: how are mass injury incidents managed in resource-limited settings? Answer: managing mass injury incidents in resource-limited settings requires adaptive strategies, collaboration, and prioritizing critical interventions. Question: what is the significance of psychological support in mass injury incidents? Answer: psychological support is crucial to address the emotional impact on survivors, responders, and healthcare providers involved in mass injury incidents. Question: how are pediatric patients managed during mass injury incidents? Answer: pediatric patients require specialized care during mass injury incidents, considering their unique needs, vulnerabilities, and developmental stages. Question: what is the role of mobile medical units in mass injury incidents? Answer: mobile medical units provide on-site medical care, triage, and initial stabilization in areas affected by mass injury incidents. Question: how are burn injuries managed in mass casualty incidents? Answer: burn injuries in mass casualty incidents require prompt assessment, triage, and appropriate interventions to prevent complications and optimize outcomes. Question: what is the significance of psychological first aid in mass injury incidents? Answer: psychological first aid involves providing immediate support to survivors, helping them cope with stress, anxiety, and emotional distress. Question: how are transportation systems established during mass injury incidents? Answer: establishing transportation systems helps evacuate and transport patients to appropriate healthcare facilities efficiently during mass injury incidents. Question: what is the role of public health measures in managing mass injury incidents? Answer: public health measures focus on preventing disease outbreaks, ensuring clean water, sanitation, and managing potential epidemics during mass injury incidents. Question: how are local healthcare systems reinforced during mass injury incidents? Answer: reinforcing local healthcare systems involves deploying additional medical personnel, supplies, and resources to support overwhelmed facilities. Question: what is the significance of disaster drills in preparing for mass injury incidents? Answer: disaster drills help healthcare providers and responders practice their roles, refine protocols, and improve overall preparedness for mass injury incidents. Question: how are communication challenges addressed during mass injury incidents? Answer: communication challenges can be mitigated through clear communication plans, use of technology, and designated communication officers. Question: what is the role of community engagement in mass injury incident preparedness? Answer: community engagement involves educating the public, raising awareness, and involving local communities in disaster preparedness and response.
Question: how are medical records managed during mass injury incidents? Answer: medical records management during mass injury incidents involves utilizing electronic health records, identifying patients, and maintaining continuity of care. Question: what is the significance of cultural competence in mass injury incident response? Answer: cultural competence ensures that responders respect cultural differences, beliefs, and practices when providing care during mass injury incidents. Question: how are vulnerable populations prioritized during mass injury incidents? Answer: vulnerable populations, such as the elderly, disabled, and those with chronic illnesses, are prioritized to ensure they receive appropriate care during mass injury incidents. Question: what is the role of international assistance in mass injury incidents? Answer: international assistance provides additional resources, personnel, and expertise to support the response and recovery efforts in mass injury incidents. Question: how are mental health services integrated into mass injury incident response? Answer: mental health services are integrated to provide psychological support to survivors, responders, and communities affected by mass injury incidents. Question: what is the significance of training and education for healthcare providers in mass injury incidents? Answer: training and education prepare healthcare providers to effectively respond to mass injury incidents, ensuring safe and coordinated care. One question: how are medical supplies and equipment managed during mass injury incidents? Answer: proper inventory management, stockpiling essential supplies, and efficient distribution systems ensure adequate medical resources during mass injury incidents. Question: what is the role of incident command systems in mass injury incidents? Answer: incident command systems provide a structured framework for coordination, communication, and decision-making among responders during mass injury incidents.
Question: how are bioethics considerations addressed in mass injury incident response? Answer: bioethics considerations involve making ethically sound decisions, balancing limited resources, and ensuring fair allocation of care during mass injury incidents. Question: what is the significance of international guidelines in mass injury incident management? Answer: international guidelines provide standardized approaches and best practices for managing mass injury incidents, promoting consistency and effective response. Question: how are healthcare facilities secured during mass injury incidents? Answer: securing healthcare facilities involves implementing safety measures, ensuring structural integrity, and preventing additional hazards during mass injury incidents. Question: what is the role of public information campaigns in mass injury incident preparedness? Answer: public information campaigns educate the public about disaster preparedness, response measures, and available resources during mass injury incidents. Question: how are infectious disease outbreaks prevented during mass injury incidents? Answer: preventing infectious disease outbreaks involves implementing infection control measures, proper hygiene, and isolation protocols during mass injury incidents. Question: what is the significance of interagency collaboration in mass injury incident response? Answer: interagency collaboration ensures efficient resource allocation, seamless communication, and a coordinated approach to managing mass injury incidents. Question: how are medical teams dispatched to areas affected by mass injury incidents? Answer: medical teams are dispatched based on the severity of injuries, available resources, and patient needs in areas affected by mass injury incidents.
Question: what is the role of mental health first aid in mass injury incidents? Answer: mental health first aid involves providing immediate support to individuals experiencing emotional distress during mass injury incidents. Question: how are medical supplies and equipment procured for mass injury incidents? Answer: procuring medical supplies involves establishing supply chains, stockpiling essential items, and coordinating with suppliers to ensure availability during mass injury incidents. Question: what is the significance of disaster recovery centers in mass injury incident aftermath? Answer: disaster recovery centers offer information, assistance, and resources to individuals and communities affected by mass injury incidents during the recovery phase. Question: how are language barriers addressed in mass injury incident response? Answer: addressing language barriers involves using interpreters, providing multilingual resources, and ensuring effective communication with diverse populations during mass injury incidents. Question: what is the role of public-private partnerships in mass injury incident response? Answer: public-private partnerships facilitate collaboration between government agencies, private sector entities, and nonprofit organizations to enhance overall response capabilities during mass injury incidents. Question: what is the significance of trauma registries in mass injury incident response? Answer: trauma registries collect valuable data that can inform decision-making, resource allocation, and improvements in trauma care during mass injury incidents. Question: how are healthcare providers protected during mass injury incidents? Answer: healthcare providers are protected through proper training, personal protective equipment, vaccination campaigns, and psychological support during mass injury incidents. Question: what is the role of military medical teams in mass injury incidents? Answer: military medical teams provide rapid response, specialized care, and logistical support during mass injury incidents. Question: how are transportation challenges addressed during mass injury incidents? Answer: addressing transportation challenges involves coordinating ambulance services, arranging evacuations, and utilizing air transport for critical cases during mass injury incidents. Question: what is the significance of radiation safety measures in mass injury incident response? Answer: radiation safety measures are essential to protect responders, patients, and the community from radiation exposure during mass injury incidents involving radioactive materials. Question: how are community shelters and evacuation centers managed during mass injury incidents? Answer: community shelters and evacuation centers provide temporary housing, medical care, and support services to displaced individuals during mass injury incidents. Question: what is the role of disaster recovery plans in mass injury incidents? Answer: disaster recovery plans outline strategies for rebuilding infrastructure, restoring services, and supporting affected communities after mass injury incidents. Question: how are medical waste and hazardous materials managed during mass injury incidents? Answer: proper disposal of medical waste and hazardous materials prevents environmental contamination and ensures safety during mass injury incidents. Question: what is the significance of incident reporting and documentation during mass injury incidents? Answer: incident reporting and documentation provide accurate records of actions taken, decisions made, and outcomes achieved during mass injury incidents. Question: how are spiritual and cultural needs addressed in mass injury incident response? Answer: addressing spiritual and cultural needs involves respecting diverse beliefs, providing spiritual support, and accommodating religious practices during mass injury incidents. Question: what is the role of non-governmental organizations, NGOs, in mass injury incidents? Answer: NGOs provide additional resources, expertise, and support to complement government efforts in responding to mass injury incidents. Question: how are pharmaceutical supplies managed during mass injury incidents? Answer: proper pharmaceutical supply management ensures availability of essential medications, vaccines, and medical supplies during mass injury incidents.